My name is Amy. I am an employee here at Brookwood Baptist Medical Center. I'm here with some of Brookwood Baptist Medical Center's awesome labor and delivery nurses right here in front of Labor Day. And we are here to talk about all things labor and delivery here at the hospital. In case you expecting mamas have any questions that you'd like to ask, make sure you get those prepared. We're going to answer some Facebook Live questions in a minute. You guys want to introduce yourself to the camera?
Sure. My name's Courtney Dodd. I've worked here at Brookwood for 12 years now, and so I've done labor and delivery, prenatal education, and I've also done lactation.
Cool. I'm Sarah Catherine, and I have been here in labor and delivery for 5 years.
Awesome. Cool. So let's dive right into some super awesome labor and delivery questions for you guys. The first one is, how will someone know if they are in labor?
So that's a really good question. We get that question all the time here. So we normally, in our childbirth classes, we talk about the 511 rule. So when you contract about every 5 minutes, and they're lasting at least for 60 seconds or a minute, and you're doing that for an hour. The best thing that we usually try to encourage our patients is to talk to their physician. So while you're going to your prenatal appointments, your doctor should talk to you about how to notice the early signs of labor, or just when you're going into labor, and so that way you can always call them first and talk to them day or night. So even if it's in the middle of the night, you can call their office and get a hold of somebody to help you kind of work through that.
Cool. All right. So what about, is it, when your water breaks, is that going to be an obvious thing that I'm going to note, or everybody's going to notice, or how does that work?
You'd be surprised how many people we get in through our OB emergency department that come in and they're like, I think my water broke, but I'm not quite positive.
Yeah.
9 times out of 10, it's going to be a big old gush of fluid, and then it's going to continue to trickle.
Okay.
So if you come in and you're like, I think my water broke, it's just been, but some people will have just a steady trickle that continues for a little while, and they'll just watch it.
Yeah.
They can put pads in their underwear, check it kind of continuously, and if they're having to change their pads, that's probably your water.
And it's okay if you come into the OB
And it's not.
and it's not.
Yeah.
That happens all the time.
That
Does
definitely
happen
happens.
a lot.
Great, cool. Okay, so it's time to come to the hospital, right? You're getting ready to pack your bags. What are some things that women really, really need to think about to put in their bag?
The first thing I always tell people when I'm teaching classes or when people inquire about that is just to kind of put you at ease. If you come to the hospital and you don't have anything at all, you're going to be just fine. So most people never leave home without their cell phone, so you'll have that to take pictures of the baby. But here we have gowns, we have panties, we have pads, we have onesies, we have diapers, we have wipes, we have little bassinet that the baby can sleep in. So we have everything that you would need for your hospital stay in case you just kind of came in a panic and you forgot things. But, there is a whole list that you can get, and I can let Sarah Catherine kind of talk about that a little bit.
I know that when I had my little boy 3 years ago, I started packing my bag when I was probably 35 weeks. And it included things from, like, comfy clothes to wear while you're here, because a lot of times if you have a C-section, you don't want anything tight on your belly. You don't want anything that's going to be constricting. Good nursing bras. I wanted my own pillow. Some people want to bring their own blankets. Some people want to bring their own towels from home, kind of things that'll help them. I've even had people bring pictures of their families up here to look at. Maybe 1 or 2 people have done that. It's not a lot of people. But just anything that'll kind of make you feel comfortable during the whole experience.
Yeah.
Some people will bring fans, personal fans, but
Yeah.
for the most part, we've got everything here that you could possibly need. Shampoo, conditioner, but
A lot of toiletries.
I tell everybody, it's like the fluffy stuff that we, like our own shampoo, our own conditioner,
The things
your
that make you
makeup.
Right.
Yes, and your phone chargers, because
Yes.
you're
Your phone
constantly
chargers.
on your phone, posting on Facebook or updating family, and so
Yeah. I can't imagine being in labor without a phone.
That's
And like
like-
letting everybody know how
and
miserable I am.
a lot of people really stress out when they get here and they say, oh my God, I forgot my breast pump.
right.
You don't need your breast pump while you're here.
Yeah.
If you do need a breast pump while you're here, we've got them upstairs for you.
Okay.
So don't worry about loading that into the car and unloading it and everything. We got it here for you.
That's
So-
awesome. Great. Okay, so let's say that someone is planning to go natural. They have like really good intentions, and then they get in that bed and it is really, really hurting, and they decide, okay, epidural. At what point is it too late to get an epidural? Is it too late to get an epidural at some point?
We've got an epidural girl right here and a natural girl right here. This is great.
Yes.
So you can speak to both
Yeah,
sides.
To
yeah.
both sides of
Great.
it.
Yeah, I went unmedicated with all 4 of my children. So
God bless you.
So yeah, so I love it, and but I'll let Sarah Catherine answer the epidural type question.
We've got great anesthesiologists that we work here that are on our floor all the time, 24 hours a day, who are pretty much available whenever we need them. As long as you're able to sit relatively still
and the baby's not about to come out.
You can get an epidural. Giving patients epidurals when they're 0 centimeters dilated, and giving people epidurals when they're completely dilated and ready to start pushing.
And I've too.
Awesome.
I've had moms that are 10 centimeters, and that's the magic number.
So Courtney could have gotten an epidural when she got to 10 centimeters if she wanted.
She's
just a trooper, whereas I
need the drugs.
Yeah.
I say like God made drugs for a reason.
Yeah,
that's my opinion. Okay, so that's great to know. What about when you were laboring and you know that there's some family members out in the waiting room that are just dying to know what's going on, but you'd rather just be in your own moment with you and your support person. Is there a way to keep family members out until you're ready for them to come in, or what's that process look like?
Absolutely, yeah, that's a really good question. So we have, we welcome families and we love having families in the room if that's what your desire is. And so if it's not your desire, the things that we've talked about this before, we talk about with our patients is, always having like a code word, to kind of get people to step out and say, oh, can I have blah, 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 and then we can kind of, ask the family, hey, we're just going to let you step out for a little bit while mom rests. I usually will kind of use the excuse, and I try to tell my patients and their support person, just, let me know, and I can be the bad person.
I was going to say, I always tell my patients, let me be the bad guy. We don't need anybody in your family getting upset at y'all today because y'all don't want them in here. But then on the flip side of that, you have people sometimes that are in here like, what's the limit? Like, what's the number of people I can have in here before it becomes a problem?
Yeah.
But that's something that, talk to your doctor about it, because some doctors are like, I want one person in there. Some doctors are like, it's a party, like it's a birthday party, like let's all celebrate.
So it depends on your doctor.
Depends on the doctor. So just talk about that in the office. If you want mom and grandmom and mother-in-law and sister and niece and cousin all in there, just
talk to
run it by your doctor.
Cool, that's good to know. So, because some things are hospital policies and others are doctor preference, so it's good to know the difference between those two. What about, and this is a question I have actually, because I've never had kids. Will I be able to eat anything? Will I even want to be able to eat anything, drink anything while I'm in labor?
So everybody's a little bit different. Sometimes, we'll have patients with epidurals and they, want all the clear liquids. Our epidural patients, we have, popsicles, anything clear, Sprite, water, juice, those kind of things for our patients. Sometimes when moms come in and they're wanting to go unmedicated, if they're in that early part of labor, sometimes they will want like a light snack where it's like crackers or bananas. And that's also a really, really good question that if you're planning to go unmedicated, it's a great question and a great thing to talk to your doctor about. And just kind of get a feel for, how they feel about that.
I think a lot of people are taken back by when you get here and they're like, can I order something to eat? We're like, we really can't let you eat right now.
Yeah.
So I usually kind of tell people eat before you come in.
Right. Stuff your face one last time.
Because you don't know how long this is going to take. It might be quick and it might be tomorrow.
Yeah. Right. So, and usually if you're in a lot of pain, then you a lot of times don't want to eat. So.
Yeah. I can see that. But then once you have your baby and you're up to the postpartum floor, what happens then with the food?
So moms get a tray and the support person get a tray. If they choose to eat the food here, you can also bring whatever food you want into the hospital. A lot of people will deliver here.
Right.
The Waiter app is great for having people deliver food to you. Family members are great.
Yes. Don't turn down food at all.
Yeah.
If somebody wants to offer to bring you food to the hospital, then say
take
yes.
Them take them
or at home. Or at home.
Do we have a question?
Well, if I see we've got a few people watching, if y'all will just throw out some likes or some hearts to let us know that y'all can hear us, that would be great. We want to make sure that everybody can hear all of our answers. So y'all give us some emojis. Let us know that y'all are there.
Real-time feedback is always great. So that's great that we've got dads that are support people that are able to be fed while mom's fed too. I know that's really
love that amenity.
That's really important to a lot of people.
And going back to on the getting to eat, now Brookwood offers the birthday box.
Yeah.
Yes.
And so the day after you have your baby, you actually get a small personalized dream cakes that you can share or not share.
That's awesome.
So cute. Birthday hats and little plates.
Little onesie.
Yeah.
Just make it a big old birthday.
Maybe we'll do another Facebook Live just
for that.
Just
for the box.
Yes. Okay, food for thought. Okay, so let's talk to the next question. When will I be, or will I even be transferred from another room once I deliver, or is this my room the whole time? How does that work?
Yeah, that's a really good question, especially because if you haven't taken a tour or anything like that, and you're coming and you've already had children, and you're just like, hey, I already know how everything works. I'm just gonna come in and have my baby. So here at Brookwood, we have LDRs, that's labor, delivery, and recovery. So while you're in labor, you'll be in a room, then you'll deliver, and then you'll stay down in the labor and delivery room for about 2 hours after you deliver. And so in that time, there's a lot of things, that are happening. We're trying to do skin-to-skin care, breastfeeding, so all those different things. And, that's another time where sometimes people want all their family to come in, and they're very comfortable with doing skin-to-skin and breastfeeding with their family in the room. And some people will say, I want that first hour, or I want the whole 2 hours.
And sometimes I have people, this isn't really even a part of this question, but sometimes I have people that want their family to come in, but they don't want dad and brother in there while they're trying to breastfeed. And so everyone's itching to see baby, get their hands on baby, get some pictures so that they can share it on Facebook. And so I usually tell my patients, why don't you get them in here for just a couple of minutes? It kind of scratches the itch and lets them see the baby before they just go crazy, just sitting out in the waiting room, fiddling their thumbs and asking,
yeah,
when can come back?
That's a great tip. That's a good tip. You get 5 minutes.
Or the other thing that I'll tell my patients is nobody knows you're delivered until you tell them. So you don't have to send, we all feel like we live in a day and age where everything has to go on Facebook immediately, or Instagram, or we have to text our entire family as soon as the baby's delivered. But you don't. There are things that are left that can be private for you and your support person. So, you can have that time with them, and with the baby, and so that way, and they'll never know unless you tell them.
That's an excellent tip. Are we good on vocals, you think? Okay, fabulous. All right, here's an uncomfortable question, but we're just going to throw it out there. Is it true or false, that you may or may not poop during delivery?
So that is
true. Yeah.
I usually tell them, people ask it all the time when they come in. Is it true that I'm gonna poop on the table? Am I gonna do this? I always tell my patients, if you use the restroom while you're pushing, that means you're pushing right. Tell my patients you use the same muscles to have a baby as you do to have bowel movement. So we need you to push like this.
A lot of times that's how we coach them to push. You're
gonna
bear down like you're having a bowel movement.
Yeah.
Push down hard.
But the thing to remember is that we don't announce it in the room.
We don't broadcast
It's not a big deal.
That's excellent.
We just clean it up, and you're not told that it happened or anything like that. We just clean it up, change your pads, throw it in the trash in the bathroom,
And we just go on.
and you just keep
part
pushing.
of it. Yeah, it's part of it. Awesome. Glad we got that one over.
And we see it all the time, so it's not anything.
That's what it is. It's not common.
it's
It's not uncommon.
it just
sometimes
Y'all are you probably sound a lot worse
Yeah.
too, honestly. Awesome. Okay, so we talked a little bit about the skin to skin. What are it's about 2 hours, right? That you encourage that. What are the benefits though of doing that for mother and baby?
Yeah.
So I usually just try to tell people, when babies come out of the womb, when they're out in the world, they don't know how to do anything. And so being on mom helps regulate their breathing, their oxygen, their heart rate. It just kind of helps them to adapt to just being on the outside. And then it just kind of helps bond, because this is the first time mom's had baby on the outside and not on the inside.
Right.
And a lot of times while baby is skin to skin, baby will start showing signs of being ready to eat, which might be smacking his lips, sucking his thumb, rooting around, turning his head side to side. And typically within that first hour, babies are ready to try to start nursing. Not always. Some of them come out of the womb sucking their hands, ready to start eating. And then if you leave them on the breast, on the chest long enough, they'll eventually make their way down to the breast to start nursing.
It's so sweet. It's like a breast crawl, isn't it?
Yeah.
Breast crawl.
It's so sweet.
That's
it's
awesome.
So
Okay, so that answers my second question about how long after delivery. So even
our
sometimes
goal is
within-
hopefully in that first hour to get the baby to the breast, but we're just looking for those early signs of hunger.
And then kind of just going off of that too, if heaven forbid your baby had to go to the NICU for some reason, we do try to get you stimulated during recovery with hand expression to try and get, since you're not going to have that initial latch and everything with the baby, so we do try to go ahead and get that.
That's great. Okay, so what about how long can a woman and her support person plan on actually being in the hospital?
So with a vaginal delivery, you usually will stay 2 nights after delivery. So if you came in a night before and weren't in labor, it's after you deliver. You're in the hospital for 2 nights, as long as everything's uncomplicated and normal. And for C-sections, normally it's 3 nights. But you just need to keep in mind that, sometimes things happen, and so obviously, your doctor and you together will make that decision as far as what's best for your.
It's a case by case basis.
Yeah, absolutely. Yeah.
Yeah.
Generally speaking, 2 days
nights
and 3. Yeah, 2 nights and 3 nights.
Yeah, with some caveats.
Right.
Okay, what is the recovery time or what is the recovery time for a vaginal birth versus a cesarean? Because a cesarean is essentially a surgery,
It is a
which
surgery,
has
for
more
sure.
recovery. So talk
Yes.
about that just a little bit.
That kind of goes back to like when you asked the question about like how I know if I'm in labor. Like labor is different for every single person.
Yeah.
After I had my little boy, I was up moving around that night, and I don't think I ever really had
Me
any
too.
downtime. Then you have some people that
Just
don't
harder
they just
for them to
harder
recover.
recovery.
Yeah.
I've heard some doctors say before that if you do tear during labor, the recovery from that can be the same as a recovery from a C-section. You're just recovering from different places.
Yeah.
And so I think it just depends on
And
the
everybody's
person,
pain
like
tolerance
the situation.
is
and-
different.
Yeah.
Everybody has different pain tolerance, and everybody has a different body. So we're all
Yeah.
gonna heal differently and at
Yeah.
different, stage or different times. So
Yeah.
I think that it's really, just a person by person.
Case by case
Yeah.
basis. Yeah. Okay. All right. What is since you guys have been here for several years, 5 and 12. Wow. Of all the things that you have seen, and even in y'all's own experiences having kids, what is your number one tip for getting through labor and delivery?
I would say kind of, I guess, roll with how things are going. So it's always good to, it's nice to have a plan as far as just saying like, oh, I would love to, go into labor. I would love for my water to break. I would love for this to happen. But unfortunately, we don't always know what exactly is going to happen. And
Yeah.
so
Our bodies are unpredictable,
Right.
and
I had plenty of plans. I've had 4 children. I had so many plans. I worked in labor and delivery. I knew too much. It was like, this is how I wanted it to go.
Yeah.
And so just being flexible, and just realizing that sometimes it goes exactly how you've planned it in your mind, and then sometimes it does not. But we want you to have the best
Good
experience,
experience, yeah.
that you can have, and we love what we do. Like, we genuinely love our patients, love our families, and really want it to be a great experience for everybody.
Yeah. So that goes to my next question. Why do you love working at Brookwood? What's your favorite thing about working here?
I think one of my absolute favorite things is all the people I work with.
Yes,
Yeah.
Like I
agree
truly
with that.
love sometimes I'll sit in the parking deck when I get here just to see who's driving in. Like just to see who do I want to walk with today.
Because it's a long walk.
It is a long walk up the hill. And I think no matter what happens throughout the day, someone's got your back.
Mm-hmm.
And if something happens, if something's going south in your patient's room, then you've got great hands on board. We've got a lot of really skilled nurses and doctors, and
We have great nurses,
Yeah.
great doctors, great anesthesiologists, and we really all just love what we do. And I'm not trying to sound cliche, but we do. We wouldn't do it if we didn't.
Yeah.
It's not always glorious.
And seeing, I remember the girl that oriented me said one time that her husband had told her, because she was saying something about work, and he said, "You gotta remember, this is these people's best day of their life."
Right. Oh yeah.
And that's
the
he
day
felt
they're
that all
gonna
the time.
remember
He was like,
forever.
"You see this day after day. Sometimes you see 2 or 3 deliveries in a day,
Right.
but this is their delivery. This is them bringing their baby into the world,
And you're a part of it.
And they're gonna remember you for the rest of your life. They're gonna
Yeah.
remember how you treated them, how you acted." And I mean, I truly love it. There's something special about, I still cry at some deliveries.
Oh,
I
yeah.
still cry at deliveries.
Really?
Yes.
Especially when the dads
The
cry.
dad it does it every time.
Oh my gosh, when the dad does, I'll lose it.
Excuse me, please. That's funny. All right, so I'm assuming there are a couple people out there that are pregnant and they maybe don't know where they're going to have their baby. There's lots of choices here in Birmingham. So if you've got one nugget to convince somebody to have their baby here at Brookwood, what would it be?
Oh man, that's
We can only say one.
Well, you can.
throwing a lot.
Yeah.
I would just, circle back around to just what
Yeah.
we said. Our nurses genuinely care so much about our patients, and we care about our families. We care about the whole experience, and we want it to just be great for everybody that comes in. And I would say just our team as a whole, and so that involves the nurses, our techs that help us at all of our deliveries and
Yeah.
C-sections. So our nurses, our techs, our secretaries, everybody that helps this unit run and be the best that it can be. Our physicians, our anesthesiologists, we have awesome doctors, we have awesome anesthesiologists. So it's really a big, as we wear our Team Brookwood shirt.
And I didn't even tell them to do that.
Yeah, so as we wear this, we are truly an awesome team here.
And I think we've got just a lot to offer as far as like the amenities and stuff that we have here.
Yeah.
We've got a tub that people can water labor in. In the event that we have a couple of water laborers, we've got a couple of tubs that we can use for blow-ups. We've got big rooms. We've got the rooms upstairs are just about the size as this, like very accommodating for large families.
Right. We have birthing balls. We have the peanut balls, which are, some people don't know what those are, especially if they've never had a baby. So the peanut ball is just like one of those exercise or birthing balls is what we call them. But it's in the shape of a peanut. So we'll show y'all one in a little bit. So it's literally like a very large peanut shape. We have birthing bars, so that you can use those if you're planning on going unmedicated. And we have a birthing stool. So we have.
We've got the birth navigators who can really
What's a birth
walk you
navigator?
through like all the questions you've got.
Yes. So a birth navigator, which is an awesome thing that we've been doing for almost a year now, is where we can meet with you one-on-one and sit down and answer any questions that you have. Sometimes people really love a classroom setting and they love coming to our prepared childbirth classes and talking in that group setting, but then some people have more private questions that they would like to talk about. So the birth navigator experience is where mom, dad, mother-in-law, mother, grandparents, they can come in, we can talk about the classes and amenities that we offer here at Brookwood, and we can answer any of your personal questions you have. We also will give you a tour if you want to do that during your appointment.
Yeah.
So it's great. I love it.
It's great that as somebody who hasn't had a kid and might have questions to ask one-on-one instead of in front of a whole bunch of people.
Right, because sometimes you do have these kind of questions. Is it true that I'm going to poop while I'm in labor?
Yeah.
So, some people are not going to raise their hand in class and say, oh, I have a really important question.
Yeah. That's more of a
I love the
one-on-one.
one-on-one part of it.
Yeah.
Well, and then we have the classes for big siblings.
Yeah.
Grandparents. Like I think there's even like a daddy boot camp class where you can.
Yes.
There is, yeah.
So
lots of amenities here at
lots of
Brookwood for
amenities.
sure. Okay, so let's see if we have any questions from the audience, and then we'll do a quick tour of the room. How's that sound?
Sounds great.
What do we got? We do. Kristen Armstrong wants to know if she can wear her own labor gown.
Yes,
Absolutely.
I had my own labor gown.
Oh, you should have
Sure.
brought it.
I know.
Man.
We usually tell people that with your labor gown, if you're planning on getting an epidural, just for it to be able to be like backless or if it
like
has
button or Velcro.
the Velcro. A lot of people have the ones that have Velcro on the sleeves or Velcro down the back or the buttons on the sleeve
Have to
and
have
buttons on the back.
access to your back.
Yeah.
If you're planning on getting an epidural.
And you know what? You can actually buy those. I think
In
in
the
the
gift
shop,
shop.
the Brookwood gift shop.
Yeah,
So next
have
time
them.
you're here for your appointment, go down to the gift shop and go snag you one.
Yes.
Yeah.
That's a really good point.
Great. Catherine would like to know if you can have skin to skin after a C-section.
Yes.
Yes, that's such a good question. Yeah, that's a great question.
So after baby's born, they'll take baby over to the warmer and get baby cleaned off a little bit, get a weight, and then we'll bring the baby over for skin to skin. You'll get to do skin to skin for a pretty long time. Then as soon as we roll back into the room and get a set of vital signs, we'll bring baby right back over, and that's when your hour of skin to skin
So
starts.
this is skin to skin after C-section. Is that like while they're putting
Yes, while they're still the
while
doctors
they're still putting mom back together? I don't
the
know what
doctors
else to
are
say.
still finishing up the surgery while, like Sarah Catherine was saying, so baby, comes out and the physician would, the doctors will show the baby over the drape and say, oh, look, isn't here, she's so cute.
Yeah.
So then the respiratory therapist just takes the baby to the little warmer, and then we have mom cams, so we have little TVs in all of our operating rooms. So even while the baby is on the warmer, we have a
Mom can
TV
still
screen
see kind of
where you
what's
can
going
see
on.
the baby the whole time. And then the nurse will bring the baby back over to mom to do skin to skin. So the nurse brings over the baby to mom. So mom's the first person that gets to hold. So even though dad may be at the warmer, the nurse, dad doesn't hold
Back
the
off,
baby
Dad.
first. Or so your support person, whoever your support person may be. In your delivery, so the nurse will bring the baby over, and then y'all can do skin to skin while the physicians are still finishing everything up. So
Yes. Cool.
it's a very good question.
Yeah.
That is all the questions we have.
Cool.
So if anyone else while they are doing the tour, please, y'all ask some more. We'll be sure to ask them before we wrap up. But yeah, if you guys want to do a tour.
Yeah, show us what. So we're in an actual labor and delivery room here at Brookwood, and they're going to show us what these little purple happy toys are.
So this is a birthing ball. A lot of people kind of get sick of the bed. Just laying in the bed can be just uncomfortable. And you got to remember these beds transform. They're made to break down for delivery. We've got some stirrups underneath here, and I can get it out. There you go. Stirrups go up. So the beds aren't super comfortable, so a lot of people like to get up out of the bed. We've got a birthing ball, lots of different positions you can try with that.
This is a peanut ball. So this one we were talking about earlier. It's literally in the shape of a peanut. We use this a lot of times. You can use it when you're unmedicated, obviously, as well. But a lot of our moms that do get epidurals, we use this a lot. So you think about when you sleep at night and you put a lot of pillows between your legs and you're propping. So this will just kind of help keep your pelvis open, and it allows the baby's head to descend and come down, into the pelvis. So these work really good. We love these. So we have these here, so you don't have to bring your own. Same thing with the birthing ball. You're more than welcome to bring your own,
we
have them here.
I think we've got at least one for every, at least one peanut for every room.
Yeah.
All the rooms will have recliners like this. I always feel bad when I come in the mornings and the dads are sitting straight up in them. They do actually recline all the way back so that you can get as comfortable as you can.
This is just all of our monitoring equipment, and like Sarah Catherine was saying too, that the stirrups come out, so this bottom of the bed will come off as well. But that's our equipment. Then, after the baby's born, and once we're getting close to going upstairs, and we're not, after we're done skin to skin and we're done with breastfeeding, this is where just all the baby's stuff is for us to take care of baby. So this folds down. And this is a little bed that baby can go on just while we're trying to get mom cleaned up before we go up to the postpartum floor. So that all just comes out.
And then I think one of a lot of people's favorite things is the bathroom. It's a large bathroom, and we've got the fancy bidet toilets that a lot of people will use to help clean up. The seats are warm. Everyone loves that. Grandma usually will just sit in here for a while just because the seat is so warm. But upstairs they have the same exact bathrooms as the ones we have down here. So the bathrooms upstairs have all the bidets and the warm toilet seats and the nice showers with the handles and the grippers and everything. So great bathroom.
Like a hotel bathroom, kind of.
Yeah.
Awesome.
With a bidet.
All right. Well, do we have any other questions from the audience, or are we?
We do.
Oh, fabulous.
Prompting did it. So we have a question from Jessica. She asks, on her birth plan that she received, there was an option to watch the baby come out during C-section. Can you talk about that?
She's probably referring to the drapes that we have. One of the drapes that we use in the C-sections it's clear, and it has a little piece of blue above it.
Like a blue cover on it.
A blue cover
so
that drops down
down
during the C-section, like when the baby's getting ready to be born, so she can actually watch the baby be born. And the same goes, for vaginal deliveries too. Some moms want to watch the delivery, and if that's the case, then we have mirrors that we can pull into the room for the mom to watch. So.
Is that with the cesarean thing? Is that based on how the doctor prefers, or is that how it?
I've never had a doctor that said no.
Okay.
Yes.
That's good to know.
So yeah, clear drapes are definitely an option.
Yeah.
Most of the time, it's the patient. They're
That
like, I don't want to see it because we'll offer and say,
There's something about seeing something come out out of the
from
middle
surgery.
of your belly.
Yeah, from surgery.
I'm in that camp too. Yeah. What else we got, Tracy?
We have someone else that said that they loved the peanut ball during their experience.
Yes,
so that's
yes.
great.
We love it too.
And then quite a few people who have been patients and who have loved their experience.
So we always like to hear that.
Come back.
Keep the love coming. Well, thank you guys so much.
Yes,
I know
absolutely.
you're not even working today, so she's a trooper. And I hope everybody has a great Labor Day, y'all too, and we will see you next time.
Awesome.
All right,
Thanks.
bye.
Thank you.
Thanks.